Today we're going to discuss briefly the procedure that you're about to have. You've been referred by your physician for a pain management procedure, either involving your lumbar or your cervical spine. We will go over the basics of why we do the procedure, and then we'll head over to the scanner briefly and show you a brief introduction as to how the procedure will go today. I wanted to briefly take a few moments to explain the basics of the procedure that we're doing and why. First procedure that we do is called a transforaminal epidural steroid injection. That is typically done for patients who have a quote-unquote pinched nerve. When we look at the spinal model, this would be a lumbar spine. If it were in me, it'd be sit just about exactly like this. Okay, so this is the sacrum or tailbone area. This is the lumbar spine. To give you an idea of what we're talking about, this is a vertebral body. The more white area is the disc. You can see when we compress the model, just as in the human body, the disc serves as a compressive shock absorber. As you also look here from the top, this would be the spinal column where the spinal cord and canal come down through this region. The nerve roots are going to exit through these holes, which we call foramen, on the sides. They will pass down adjacent to the spine and go down to your legs primarily and perform their function. Transforaminal epidural steroid injections are typically suggested in people who have what we call radicular symptoms, which is symptoms usually down into the lower extremity, oftentimes down to the foot, pain, weakness, strange feelings, etc. The typical cause of that is a quote-unquote pinched nerve, which I'm sure you've all heard. What typically pinches a nerve is either compression on the nerve as it exits through this hole by a bone spur, which can form, typically as the result of long-standing arthritis. A disc can herniate, protrude, or quote-unquote slip. I'm sure you've heard some of those terms as well. This can push its way into the hole or foramen, press on the nerve root, result in compression on the nerve root. Third thing is the ligaments and other tissues in the area can become inflamed, and similarly again, press on the nerve root. The goal of today's therapy will be to actually place a needle from the skin surface, utilizing the CAT scanner to guide us, directly at the opening of that foramen and inject primarily cortisone with a small amount of long-acting Novocaine as well. The goal will be for those two agents to decrease the inflammation on your nerve root itself, getting it back to normal function, but also to serve as a strong anti-inflammatory. Thus, the long-term goal being to get the additional inflammation in the soft tissues out of the area so that nothing else compresses that nerve root to the point where you will get the return of symptoms. That is our goal. As long as we continue to get increased and improvement in your symptoms, we will proceed out to a maximum of 3 injections, which will typically divide over a 7 to 10 day time frame. The reason for the division in time is simply to let the small amount of steroid that we're injecting be metabolized and totally leave your body so that it's completely safe again to inject another dose. Oftentimes I'm asked by the patients, how long does it take for this to work, doctor? Typically, patients will begin to feel relief anywhere from 2 to 6 hours after the procedure, occasionally sooner, all the way out to as much as 24 hours after the procedure. What I like to tell the patients is, let's see where you are tomorrow when you wake up. That's going to give us a good idea of how well this procedure has worked. Also, for those of you who are here for a cervical injection, either into a cervical facet or a cervical transforaminal epidural steroid injection into the neck region, I wanted to tell you that basically everything is exactly the same, but you can see here when we use our model, this is a model of the cervical spine, again would be roughly about like this on me. The anatomy is much more compact and a little more difficult to point out. So I chose to use the lumbar anatomy and the lumbar model just to make it easier for you to see and understand what I'm talking about. But otherwise, the procedures are exactly the same, other than, of course, rather than working in your lumbar region, we'll be working in your neck. In summation, transforaminal epidural steroid injections, we will do the injection at the level of the foramen or hole where the nerve root comes off, typically directed at a patient with symptoms down the legs or what we call radicular symptoms. We place the needle directly near the nerve root and do our injection. Allow the cortisone primarily that's in the injection to de-inflame the nerve root and hopefully de-inflame the other tissues that are compressing on the nerve root. In conclusion, we appreciate you coming and trusting your care to us today. Millenium Physician Group, one of our strongest attributes is the integration of care that we have here. So the ability of your primary care physicians to get timely and accurate information to us on the radiologist/pain management side, and our ability to access your images directly is a very key link that makes our practice the best it can be and allows us to take the best care of you, our patients.